So welcome back to my channel. So we are starting the head and neck revision session. We'll follow the marathon picture question format. Here you can be able to see a sagittal section of the head and neck. You can appreciate that these are cervical vertebrae. This is the second cervical vertebrae, the axis. This is the odontoid process. This is the C1 vertebrae or the atlas. You can be able to appreciate the foramen magnum. So this is the spinal cord. These are intervertebral discs. You can be able to appreciate the hard palate, the soft palate at that point, and this, remember, is the fossa of Rosenmuller. Now this is the tongue, so the tag labeled C is on the tongue. You can be able to appreciate here, these are maxillary teeth. You can be able to appreciate the turbinates of the nose here at this point, and this is the cranial cavity. Then what you have here is the sphenoid sinus. So in regards to the structure labeled C, which is the tongue, the innervation, you are being asked for both motor and sensory. And so remember, the motor innervation will be the hypoglossal nerve. The sensory innervation will be lingual for general sensation, the chorda tympani for taste in the anterior two-thirds of the tongue, and glossopharyngeal for taste, the posterior third of the tongue. Now, part labeled B of question 1, you outline the lymphatic drainage of the tongue. So the tip of the tongue drains to the submental lymph nodes. So the right half of the tip goes to the right submental, the left half goes to the left submental. Then the lateral anterior two-thirds of the tongue goes to the submandibular lymph nodes, and the medial anterior two-thirds goes to the deep cervical lymph nodes. You can appreciate the thyroid gland being pointed here. Okay, so you can be able to see the thyroid gland being pointed there. These are the strap muscles that have been reflected away, and this is the larynx. So you can be able to appreciate that it produces hormones. So we have T3 and T4, which are produced by the follicular cells, and calcitonin, which is produced by the parafollicular cells. Then you have the common carotid here. So this is within the carotid sheath that has been opened up. You can appreciate the carotid sinus there. You can appreciate the bifurcation into the external internal carotid artery, and then you can see the loop of the hypoglossal nerve at that point. So you can be able to appreciate this is the carotid sinus. The innervation of the carotid sinus is via the nerve of Herring, which comes from the glossopharyngeal, and it innervates baroreceptors, which are there for blood pressure regulation. So remember, you have this reflex blood pressure regulation, where when the pressure becomes too high, you stimulate the glossopharyngeal, which stimulates the vagus, and the vagus slows down the heart rate. And terminal branches of the common carotid artery are the external and internal carotid artery. So for the facial nerve, remember, it emerges at the base of the skull from the stalomastoid foramen, and it produces many branches at that point. There are branches to the posterior auricular, to the styloid muscle, the posterior belly of the gastric, and remember, via the parotid gland, it also goes to supply the muscles of facial expression, and sensory branches will go to the external ear and the pinna. The Walde's ring is comprised of 4 tonsils. So the palatine tonsil, the nasopharyngeal tonsils, which are also found in the fossa of Rosenmuller, and when they enlarge, we call them the adenoids. Then you have the lingual tonsils on the tongue, and the tubal tonsils on the opening of the eustachian tube on the nasopharynx. So thank you. If there is any question, you can leave them on the comment section below.